Hello everyone, good to see you all and thank you for joining today's live chat. And today's live chat is on existing lifestyle and hearing loss, keeping the new normals in mind and helping our followers to understand how to conduct themselves in this period. So today on this live chat, I am going to be joined by Dr. Jafar Sura, who is an eminent ENT surgeon in South Mumbai. So I'm just going to ask him to join. So please wait. How are you?
All good.
Good. Thank you for joining us in this chat. And we are going to, share some valuable information with our followers as to what is the new norm and how they can prevent or conduct themselves in these new norms. So as we know that today's topic is existing lifestyle and hearing loss. And because of these new norms, there is an excessive use of a lot offline, conversations, virtual conversations, and virtual transactions, and that's leading to a lot of ear issues. So I would like to give our viewers some insight into what would be the impact of the use of earbuds, because most of our followers have this issue of accumulation of earwax. So how can they rid of that earwax, you know, and help themselves hear better?
Hello.
Yes.
Yeah. So basically, earbuds have been used for ages and ages, and I think that has made our lives a little bit difficult as ENT surgeons. And I'm sure you all, as audiologists, also see a lot of patients with unusual complaints because of earbuds. So one few of the common stuff that we see is, of course, the wax gets pushed in. Rather than removing it, it gets pushed in. Wax is formed only in the outer third of the canals and in the hairy part of the canals. Those hairs push the skin out, push the wax out on its own. The moment we use a earbud, the moment we use a earbud and push the ear wax in, it's not going to come out, and it will keep on collecting. It will form a focus. It will become rock hard, and at some point of time, you will have to come back to us, and we will have to clean it. So that is the issue with earbuds. And sometimes we also see, a parent is playing with the earbud, and the kid's hand hits him. It goes and ruptures the eardrum. So besides the normal stuff that happens along with wax and all, there could be traumatic events also. And besides that, uh, the right way of using a earbud is essential. You have to only use the cotton tip. It is made of that length where the canal is hairy, and it can be used safely that way rather than really pushing it in further. People ask us, what do you do? How do you clean your ears? So the ears are self-cleaning organs. It's scientifically proved that the wax comes out on its own. Some people produce more wax, fair enough. Some people produce less. Some people have decreased clearance. So all they need is a wet cloth or a dry cloth after their bath and just rub it from outside. Or if they have excessively flaky skin, just take a wet cloth, a cotton cloth, and just wipe it on the outside. Not to do anything more. That has caused a lot of issues. Yeah. Now, also, we've seen a lot of earphone use in today's day and age, ma'am. So, is there anything that what can we do? What is the harm with using earphones? As you can see, even I'm wearing one of them.
Yeah. So that's why you see I'm not wearing one.
Yeah,
I'm a little aversive to using, earphones, whether they are
yeah,
wireless or wireless. because when the sound source is so close into your ear, it increases the volume by almost 6 to 9 decibels. And this is sufficient enough to cause a hearing loss, especially when you're using it for such long hours and day upon day, because of the today's
Yeah.
time. We cannot avoid using it. I understand that, but you should also understand that what is the damage that it's causing. So apart from noise-induced hearing loss that it causes, it could lead to tinnitus, which I have been seeing very regularly in my clinic. That's the ringing of the ears, because it is the hair cells, the outer hair cells that get damaged first, and they go into a fatigue position, and so that leads to the ringing sensation in their ear. That's very disturbing. It doesn't stop on its own.
Yeah.
Give the ear rest.
Yeah.
With that, with that ringing sensation, it leads to sometimes dizziness. You know,
Okay.
say that, oh, now I'm feeling dizzy, so they rush to the ENTs, or they go to their general physicians and they take some over-the-top counter medicines and all that. But the main problem is the use of your buds, earphones, and that's where only when you probe and find out what they have been doing and what is it due to, we come to know the excessive use, especially in children also. Today,
So, but
nowadays,
what if the volume is high for a short period of time? Is it not safe? Like if I want to hear a song which is really loud by some metal rock band, so why can't I use it for just 5 minutes?
yeah, I'm just coming to that. I'm just coming to
Okay.
that. Just that with this, as just I continue with dizziness, then it could lead to little high blood pressure also, because the anxiety of tinnitus and
Yeah.
the sets in. And because, as you said, that there is no circulation of air in the ear canal, that also develops wax,
Hmm.
and that leads to more of impacted wax, and then that causes pain in the ear. So it's like a vicious cycle.
Yeah. One thing leads to the other.
Yeah, so when they come to you also, as ENT surgeons, they come to us also. You all refer us for an audiogram test. What is it
Hmm.
due to? Only when we probe a little, we get to know that they have been on. So what is the thumb rule? How do you use, as you very rightly asked, that yes, in today's norms, we have to use earphones. We are virtually connected with each other, and sometimes to pursue our hobbies also. We want to hear to certain pieces of music that we don't want to
Yeah.
disturb others. So the thumb rule is that you are using it at around 50 to 60% of your volume, you can use it for 60 minutes.
Okay.
Yeah. If you increase the longer the duration, the louder you use, then the shorter the duration has to be.
Yeah.
And if you're using it on maximum volume of your device, then it has to be only for 5 minutes,
Yeah. I
right?
guess those are some WHO guidelines also.
Yes, yes. And sometimes we've also seen that people don't use earphones. And this is just out of the topic, not of earphones, but sometimes the youngsters, when I'm talking before pre-COVID times, when they used to attend discos and
Yeah.
uh, big parties where the sound was like above 120 decibels. And I have seen where youngsters have reported that they have got sudden hearing loss.
Yeah.
Could be temporary, and sometimes it leads to a permanent damage.
Yeah.
So you have to use, these earphones very judiciously and very careful, because it's ultimately we are dealing with a delicate sense organ.
Yeah.
So even you as an ENT surgeon would be seeing a lot of people, coming in. What are your thoughts on the implications of the physical use? I spoke about the biological part. So what are the
Yeah.
physical implications of using earphones?
So before I get to the earphones part with regards to the noise-induced hearing loss, the reason that I think we are talking about this is because just from a personal experience, once I was walking through a Ganpati procession. It literally took me 10 seconds to walk through that Ganpati procession, and at the end of it, I felt my ears were buzzing because they were beating drums right next to me. And that day I realized that whatever advice I'm giving my patients, I definitely is correct advice. Stay away from loud sounds, otherwise it can be very risky. I mean, I thought I'm just walking through what will happen, but yes, that can also cause damage. So coming back to the earphone, and so as an ENT surgeon, we see a lot of patients complaining of dry ear, itching, and as a result, once the ear gets dry because of these tightly fitting earphones, they really rub against the skin. They cause dryness. And once its skin is dry, a person will itch the ears. Once they're itching the ears, they will of course cause damage. And that leads to outer ear infections, also known as otitis externa. It may lead to boils known as furuncles. More importantly, collection of wax, as you mentioned, it will collect, and sometimes water goes in. It may lead to fungal infection called otomycosis. Now, as you know, the treatment of all these things is firstly an examination, cleaning the ear thoroughly, and after that, then we go ahead and give antibiotics or antifungals, whatever. But during the course of that period, while the people are using it, we would definitely recommend avoid wearing earphones. In fact, I have started recommending to people don't use earphones, use headphones, over the top earphones, especially if you have problems. Like I don't have problems, I may develop in the future. But people who are already experiencing issues, they should rather wear headphones rather than earphones. Lastly, if I have to give a simple piece of advice, is like after you use the earphones, your skin will feel dry, you will feel itchy. So how do you prevent that? Just take a little bit of coconut oil. It's a natural lubricant. When you have skin dryness, you apply moisturizer. So when you have dryness in the canal, just take a little bit of coconut oil and rub it along that. It will help protect the skin from dryness and itchiness and hence damage. If there's no damage, you can safely wear your earphones. So that's how we treat infections, and we are seeing a lot. And the age group has also changed. Initially, as you said, only teenagers were using earphones for their entertainment purposes. Adults have rarely used it. But now, business calls, elderly grandparents who have to talk to their relatives from far away, they also need earphones. So it's becoming a widespread issue. Also, some of these, like people who are using hearing aids and earphones, if they're comparable, they have these parts which go inside and get stuck. Those are also common complications. I'm sure you must be seeing people with that.
Yes, yes. So as I was saying that the earphones when people are using canal products, the canal
Yeah,
hearing as well as the RIC, the receiver in the canal hearing aid. So that
yeah,
piece is inside the ear. So
yeah,
even wax accumulation is the major problem.
yeah,
Advise them that when there is any infection in the ear, there is some wetness in the ear, they should
yeah,
avoid the hearing aid for that. Especially when it is wet, when they are being prescribed some ear drops to be put, they should not be wearing it. And every night before they sleep, I would suggest that they should wipe the receiver of the hearing aid and with a dry. And also they have such tools in their kit whereby they can pluck out the wax that has been you
Oh,
know deposited in the receiver
okay.
of so it's easy. So you're keeping the microphone also less clogged, and
Yeah,
there is a a care and
yeah,
maintenance of the hearing. So we see a lot of cases, doctor, that when they have come that the ear, the wax has been, collected in the hearing aid.
yeah.
So it's a huge expense for them also. So
To buy
every
another one.
sending them to the company for servicing and for that.
Okay.
A trauma for them because then they are without aids. You
Yeah,
know, period of time when they are, when the hearing aid goes to the company for servicing. So this care and maintenance of the hearing aid with respect to infection as well as with respect to the earwax that's accumulated.
yeah.
So that has to be taken care of. Dr. Jaffer, I have a question that what if, many parents, patients ask me and I answer them, but I wanted some feedback to you that if they are prone to earwax, and so how would you advise them to say Solidax or Vaxol on, say, on the weekend, once in 15 days? what is your advice?
So basically, these wax dissolving agents that are there, all the drops have the same combination of para-dichlorobenzene. So they are wax dissolving. If you don't have wax, using them is useless.
Hmm.
And using them once, like every, as people say, "Okay, I put them once a week, once in 2 weeks." No, definitely useless. I feel that it's useless once a week. It just serves the purpose of making you feel that, okay, ear is feeling dry. I feel a little itchy. So let me put those drops. It's acting as a lubricant for that short period of time. Similarly, if a patient has earwax, we put 2 drops and leave it, then put 2 drops at night, it's not going to work. You have to put at least 4 or 5 times a day so that it dissolves completely. Otherwise, it hardens as soon as the eardrops dry off, right? That's my thinking, and that's what I advise. That if you have wax, use it regularly for 4 or 5 days, and it will come out. But if you put it once a week, once in 10 days, once, it's not going to help, not much. Ma'am, with regards to the hearing aids that people use, you said you clean the hearing aid with a dry cloth. Can they use Dettol to prevent fungal infections?
Yes, yes.
Like a Dettol soaked cotton swab or something?
So what I do is I advise them to use alcohol swabs
Okay, alcohol swabs.
available with the chemist, so that it evaporates. Once
Okay.
clean it, it evaporates and it becomes very clean, sterile, and so there is no scope of any infection, join setting into the ear. What is
Yeah.
a question over here in the chat as I was reading that how long should we put eardrops in a function?
So in fungal infection, generally we give eardrops for 5 to 7 days. The treatment of otomycosis as fungal infection is only to clear it and cure it. If you are not cleaning the ear, then putting eardrops is futile. You have to remove the fungus. And thereafter, fungal spores are lodged in the skin, so they may grow back and come back. So we have to give a repeat check. So normally, my patients, I apply gentian violet on the ear canal as well for that duration and tell them don't use your hearing aid. Come back after 5 days. I see the ear is completely fine. I stop all medication and keep them on follow up. But that's it, 5 to 7 days max, not more than that.
Yeah. But a couple of my patients, this been applied to eyelids and they do not like that color. And
But
they
it
say
goes
that,
away in 5 days.
yeah,
All my patients who come in 5 days, there is nothing visible in their ear. I have to go back to my paperwork to think whether I had applied or not.
oh yeah. But when I've seen a couple of them, they come immediately and they, madam,
Yeah.
itna badda dikh raha hai. So I have to tell them the doctor has done it for some purpose and it will help you. So,
Did they
but
come from me?
isn't there any other way apart, like, you can camouflage it, so that it is not
No,
that
so you
visible?
put it only in the canal. You don't put it outside on the concha, etc. You don't put it on the concha. There is no need to put it on the concha. Just put it in the ear canal and near the eardrum. That's it.
Okay, okay.
And if you
So that,
don't want it, that's fair enough. But I have recently started using it after advice from my friend, and I found it really helpful. So I applied as a rule for all patients that it has helped.
no, even my own son had, when he had
Yeah,
a fungal infection, he was applied, and that was the
yeah,
only got cured. He
yeah,
got it regularly, and then the gentian violet. But yeah, that was his take also. It had come up, it had seeped a little bit into the concha.
yeah.
It looked so bad, mom. Everyone
The
keeps saying, "Oh,
if
what's
it
this?"
seeps out, it does look bad.
Yeah, yeah. So I think, but if that's not, if that's the only remedy, I think, and if it's the safest one and a quick
Yeah,
one, we should follow that
yeah.
because uh,
There is a question, ma'am.
yes, yes,
How your words?
yes. As we just at the beginning of this chat, I think that that the use of earbuds will a continuous and a prolonged use of the earbuds will lead to a hearing loss eventually,
Yeah,
especially start affecting the higher frequency tones, and then it will transfer to the other frequencies. So we should monitor the use of earbuds and use it judiciously. And the most important thumb rule is we need to give rest to our ears.
yeah. I
That
guess that is the most important point we should mention. is that you use what you want to use, but you give rest in between.
Yes. So even if auditory fatigue has set in, with the rest given to the ears, you're rejuvenating the outer hair cells.
Yeah,
So the vibration of those hair cells is only going to give you the sensation of sound. So if your hearing will be intact. So we should monitor the use of all these gadgets, will or how important they may be in our day-to-day life. Even we have to teach this, to our children, because since now very young children are doing online classes, and
yeah,
in their earphones, and I've seen many of them flaunting their iPods and all that, but that's extremely dangerous. I tell parents that
yeah.
you cannot monitor this. It's only the child, so you need to educate this child
About the
that
volume, especially.
yeah, what implications this is going to have, and for very young children, maybe just give them for that time when they are attending classes, and then take it away. So hearing from a speaker, uh, you know, is
Is
okay.
much better.
Is
Is
much
much
better.
better.
Yeah, yeah, yeah. So there is another question that
Yeah.
prolonged earphones, like the ones you're using, can lead to blackheads inside the ear.
No, no.
Your question, doctor. I wouldn't be.
Yeah, so that won't, Varun, it won't lead to blackheads inside the ear. It'll just lead to more wax collection. No blackheads. Because blackheads are basically, I think, sweat gland related issues in the hair follicles. This is not, there are no sweat glands, they secrete wax. So we covered most relevant topics today
Yeah, yeah,
about hearing loss and especially only related to earphones. So we should organize one more such thing with related to something else which is relevant to today's day and age.
yeah. So maybe our viewers can also post as to what topics they want to have more
Yeah,
information. And I would thank all our viewers who have joined to continuously join us whenever we organize.
yeah,
And also you can give us feedback as to on what topics you would like to have more chat. So
yeah.
please stay connected with us. And thank you once again. And thank you,
Thank
Dr.
you. Thank
Safa, for
you.
connecting, and thank you for
Yeah.
a very good session.
Thank you.
Okay. Bye
Bye.
bye.
Bye. See
Bye.
you. Bye. Bye, guys. Bye, everyone.
Bye, everyone.